Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is 𝐀.𝐊.𝐷𝐒 and welcome to Pakistan Super League Cardiac Super League presented to you by Pakistan Cardiac Society and powered by Wilson's Pharmaceutical. Today we are live for the fourth match from the Super 6 stages, and this match is between PIC Warriors from Peshawar and 𝐴 Stars from Karachi. This is an important match as it will decide that who is going to qualify for the final seat at Cardiocon in November. And with this, allow me to introduce the senior faculty members who have blessed us today with their presence. Today, the match umpire is the great Dr. Mohammad Ishaq Saab. He is serving as a professor of cardiology at Karachi Institute of Heart Diseases. And from the guest panelists, we are honored from the governing council of the Pakistan Cardiac Super League. We are honored to have with us Professor Hafizullah Saab. Professor Hafizullah Saab is a world-renowned cardiologist, and he is currently serving as a chairman of the board of directors at PIC Peshawar. And with this, some other panelists were also going to join during the match, and the introduction will be done during the match. And last but not least, I will introduce the moderator of today's program as usual, Dr. Hamza Azhar Ghori Saab. Dr. Hamza Azhar Ghori is serving as assistant professor of cardiology at RC Rawalpindi. And I will now request Dr. Hamza Ghori Saab to please start the formal proceeding of this match.
Thank you very much, Hamza. So we are back again with another program, and it's the second season of Pakistan Cardiac Super League, brought to you in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. So we have now entered the Super Sixes. We've already had 3 games. It's an important 4th game, and it's going to be consequential. So the 2 teams which are up against each other are Peshawar Institute of Cardiology Warriors and Aga Khan University Hospital Stars. So it's a bright sunny Saturday, and we'll see how it goes. I'm expecting a high scoring game, to be honest, a lot of sixes all around. And it's quite honestly, it's great to have such a wonderful panel with us, and we always have our stars with us, and today in our panel amongst the experts, and we have Professor Hafizullah. Sir, it's great to have you with us yet again. I think you instill a lot of light in the show, and it's a great inspiration to have you. Along with that, we'll have more panelists joining in, hopefully, inshallah. So we will have the introductions. And yes, how can I miss the umpires? Our 2 umpires who've been there. In fact, today we have Professor Mohammad Ishaq Saab, and I think he's the life of the show, to be honest. So the 2 teams and their captains, they are ready. So I'm going to move towards the teams and the captains to give the introductions. So we will start with, randomly we'll start with PIC Warriors. Can we have the introductions, please?
Assalamu alaikum. This is me, Dr. Usman Khan Zeb, the captain of Pakistan Cardiac Super League. PIC. Sitting on my right side is Dr. Wali Salim. He is 3rd year PGR cardiology, and on my left Dr. Ataul Wadood. He is 2nd year PGR cardiology.
Welcome to the show, and I hope you're geared up for a wonderful victory. I hope so. So best of luck. Right. So moving to Aga Khan University Hospital Stars. Captain. Introduction.
Assalamu alaikum. I'm Dr. Umair. I'm the captain of the team, and to my right I have Dr. Akil Mahmood. He is in R3 in cardiology. To my left, I have Dr. Rizwan Ali Khwaja and Dr. Anna Said. Dr. Rizwan is R3 and Dr. Anna is R2.
Thank you very much and welcome to this match, and I hope the stars are going to shine like stars. Let's see what happens. Now, to the all-important toss, and it's going to be an electronic coin toss. So can we have it? Yes, we have it on the screen. So I'm going to randomly ask Aga Khan University Hospital stars. It's your call. Heads or tails? Stars. Heads or tails? So we can't hear the stars. Technical team. Are the stars with us from Karachi? Okay, so there seems to be a technical issue with the internet. We are having these issues these days, and hopefully I think we'll have them shortly with us. All right, so I believe they are back. So stars, can you hear us? No. All right, PIC Warriors, are you there?
Yes, sir.
All right, so we'll make the most of the time. In any case, it's random. So it's your call. Heads or tails?
Tails, sir.
So, PIC, you've picked tails. Roll it. Oh, so you've missed it. It's a heads. All right, so the news is Aga Khan University Hospital stars, they have won the toss. But can we have them on the screen? Okay, so we are waiting for them. They are connecting Aga Khan. So I apologize on behalf of the technical team for this hold up. Okay, so Aga Khan University Hospital stars, are you there?
Yes, we are here.
Okay, so the good
Did you
news
miss-
is you won the toss. Do you know that?
No, we don't know that.
Okay, so we asked the other team and they had called wrongly and you won the toss. Now, again, you know two questions are there. First one, you want to take the questions or you want to throw the questions?
We will throw the question first.
Okay, you want to throw the questions and we have two scenarios on the screen, two veneers, A or B. Which one do you want to pick?
We will pick A.
So, you have picked A. So, the news from the center is the stars, Aga Khan University Hospital stars have won the toss and they have selected to throw the questions and the scenario is A. Case scenario A has been picked. All right then. So, let the games begin. Can we have the scenario on the screen? Read it, please.
Scenario Case A. A 70-year-old former smoker presents for evaluation of newly diagnosed, incidentally discovered 5 centimeter abdominal aortic aneurysm. He feels well. He walks 1 to 2 miles daily for exercise and plays in a men's basketball league 2 nights per week. His past medical history is notable for hyperlipidemia and diabetes mellitus. His medication include metformin. This need to be pinned, I think.
Okay, so can you pin it, please?
We can't see this.
You will have to pin it. Have you done it?
Yes.
Okay.
So his medications include metformin 1000 milligram BID and atorvastatin 20 milligram daily. On examination, his heart rate is 72 beats per minute and blood pressure is 118/68 millimeter mercury. A pulsatile mass is notable approximately just below the umbilicus.
All right, so I'm just going to give a couple of seconds to PIC Warriors to gather themselves. And once they are ready, we'll start with the first question. So, Warriors, are you ready?
Yes, sir.
Okay, let's bring the first question. Question number 1. Read it,
So
please.
question number one. Question number 1. What is the most appropriate next step? Option A, start metoprolol succinate 25 milligram daily. Option B, start aspirin 81 milligram daily. Option C, increase atorvastatin to 80 milligram daily. Option D, repeat imaging in 6 months. Option E, referral for aneurysm repair.
All right, the timer starts now. 60 seconds.
Can we see the question again?
Can we see the question, sir?
Okay, show them the question, please. Switch to the question, the scenario. Can you switch back to the scenario? All right.
Okay, sir. Back.
Okay, back to the options.
Imaging 6 months. Yeah, referral for D.
25 seconds.
Sir, option D, delta.
Okay, D delta. Are you sure?
Yes, sir.
Okay, they've come down. They want to hit it for a 6. Let's see what happens. Lock delta, option D. And yes, that's a wonderful start. It's a 6. Great stroke. I think this is over covers for a 6. Well played. Very well played. That's the start we wanted. Now, can we have the next question on the screen? Read it. Agha Khan, are you there? All right, so I think I'm going to read it myself. Question number 2 is, what is the rupture rate percentage per year of abdominal aortic aneurysm for this patient? Option A, 0.5 to 5%. Option B, 3 to 15%. C is 10 to 20%. D is 20 to 40%. E is 30 to 50%. And the timer starts now.
The B by B money. Wow. Option B, sir, beta.
Okay, option B. So you want me to lock B beta? Sure.
Yes, sir.
All
Yes,
right.
sir.
Lock option B beta. All right. That's well done again. Another 6. 2 in a row. Great going. Well played. So, moving to question number 3. Stars, are you there? Please read the question.
Yes, sir. I'm audible?
Yes, you are.
Yeah, okay. So the patient did not do any follow-ups and almost 1 year later presented to emergency department with sudden onset severe abdominal and back pain. On arrival, he was hemodynamically stable with blood pressure of 140/80, heart rate of 90 beats per minute, oxygen saturation 98% on room air. CT angiography confirmed a rupture aortic aneurysm, abdominal aortic aneurysm, 6.0 centimeter, with a small retroperitoneal hematoma. Which of the following is the next best step? A. Immediate open surgical repair. B. Observation with serial imaging and monitoring. C. Transfer to intensive care unit for close monitoring. D. Diagnostic angiography to evaluate aneurysm morphology. E. Endovascular repair.
All right, 60 seconds on your screen.
Patient is hemodynamically stable. دی خو هغې کې دا important خبره ټیک ته رپچر دی خو it is important to evaluate the morphology. کنه ولې چې هغه patient hemodynamically stable دی ماته لږ diagnostic
aneurysm morphology diagnosis.
او imaging اگر observation with serial دا غړي
انجو شوی ده کنه کنفرم morphology دا کنفرم مطلب open
Approaching 20 seconds.
ليه شوی imaging شوی ده
You are open?
10 seconds, come on. The ball is passing the
Option A,
bat, come
sir.
on. Which?
Option A.
Option A. So they have opted for option A alpha. Lock A. Oh, that's the first miss. The ball was really far away from you and we could see that. So, anyways, you still have 7 more questions. You can put up a good total. Concentrate hard. Right. So, question number 4.
Open chikri modane, we can't stay.
I'll request the answering team to please stay quiet till the question has been read along with the options. Khan, read the question, please. Okay, so I think we've lost the stars. You'll have to bear with us with this internet situation. So it's question number 4 and I'm going to read it myself. Which of the following is not a contraindication for endovascular aneurysm repair EVAR? That is, option A, severe iliac artery calcification. Option B, aneurysm diameter of equal to or more than 6 centimeters. Neck diameter of less than 16 mm. Option D, severe renal insufficiency. Option E, aortic angle of more than 150 degrees. And the timer starts now.
More than 6 greater than equal to 6 and theory of 6 more radium how 6 centimeter
So, neck, what about severe, the neck diameter? What angles?
20 seconds. Come on, 10 seconds.
Option B, sir.
Option B. All right. Are you confident? B beta.
Yes, sir.
Okay. I don't see that vigor in the voice, but still. Lock B beta. Oh no, you were not confident. I could see that. I could hear that in your voice. Never mind. Never mind. So you've had 2 sixes, 2 misses in 4 questions. All right. So moving to question number 5. So are the stars back? So we don't have them yet. Khan stars. So I think I'm going to read question 5 myself. Which of the following statements regarding endovascular repair of abdominal aortic aneurysm is correct? Option A, primary success rates for aneurysms exclusion are less than 80%. Option B, endoleaks are a rare complication after implantation. Option C, 30-day mortality rates are lower with endovascular repair than with surgical repair. Option D, long-term outcomes are better with endografts than with open surgical repair. And option E, none of the above. 60 seconds on your screen now.
Long-term outcome to the endovascular repair.
So I welcome Professor Fawad Farooq. He's with us. Great to have you.
EVAR chidi kana choosing it has got a better outcome kana. With a 30-day mortality are lower with endovascular repair than in open surgical repair.
20 seconds, come on. Approaching 10 seconds now. Come on. 7.
Option D, sir, delta.
Okay, so just in the nick of time, they've gone with option D, delta. Lock option D, delta. Oh, that's the 3rd miss in a row. All right. PIC warriors, come on. It's not that hot over there. The weather is settling. It's hot here and in Karachi. Come on. All right. So, can we have question number 6 on the screen, please?
So
And we
question number
still-
6.
Okay, so we have stars back.
So endovascular repair of the aneurysm of descending thoracic aorta is associated with which of the following complication compared with open surgical repair? Option A, higher risk of paraplegia with endovascular repair. Option B, lower risk of paraplegia with surgical repair. Option C, higher risk of respiratory failure with open repair. Option D, higher risk of respiratory failure with endovascular repair. Option E, none of the above.
And the timer starts now, 60 seconds. I will request everybody else, except for the answering team, to keep their mics on mute, please. We can hear a lot of crosstalk.
paraplegia خو کوي paraplegia اگر دا incorrect یو شي نو هغه vessels distort کیږي respiratory failure very rare دغه وي high risk endo paraplegia دی high risk paraplegia option A sir alpha.
Okay, so you want to lock option A, alpha, right?
Yes sir.
He's come down the wicket. Is it going out of the park? Long on boundary. There's a fielder waiting over there for a catch. Lock option A, alpha. Oh my God, it's been caught. Oh, that's goodness. Another one. All right, the score is 12. 60% of the questions are gone. 4 questions left. You need these questions. Come on. Warriors, Professor Hafizullah is also here with us, and we need his support. Question number 7 on your screen.
Question number 7. What is the most common complication of EVAR? Option A, endo leak. Option B, graft migration. Option C, aneurysm rupture. Option D, limb ischemia. Option E, infection.
And the timer starts now.
graft migration هم کیږي endoleak common complication دی خو دا ده چې د دې prevalence 5 endoleak اول د دې classification protocol کې دغه شوی و option A sir endoleak.
Okay, so you want me to lock option A. Do you know the answer, or it's just a random option because there is a classification of endoleaks? Okay, so let's lock option A, alpha. Yes, you got it right, but still. All right, I think all's well that ends well, but still I think we have 3 more questions. A score of 18 is there. Come on, Warriors. Next question coming your way. Question number 8.
Question number 8. You successfully repaired this 6 centimeter aneurysm by endovascular repair. A year later, the aneurysm has continued to grow by 1 centimeter on a follow-up CT scan. There is no contrast seen within the sac of aneurysm. What is this an example of? Option A, endoleak type A. Option B, endoleak type 2. Option C, endoleak type 3. Option D, endoleak type 4. Option E, endoleak type 5.
60 seconds on your screen.
wow second بیا هم لږ سوچ وکړئ time we have still lot of time. What about 2? 1 centimeter grow دی کنه خو still نه نو چې نو دا خو په ما کتلې دي خو how کنه
Okay, 10 seconds. Come on.
option A sir
Option A. Are you sure? Should I lock?
Yes, sir.
All right. We'll lock A alpha. All right. So that's a big miss, I would say. Anyhow, 2 more questions to go. Now, question number 9 coming your way.
What is the most common type of endoleak? Option A, endoleak type 1, endoleak type 2, C, endoleak type 3, option D, endoleak type 4, option E, endoleak type 5.
And the timer starts now.
متى 3 4 के कॉमन लगी वाले छे ना एंडोलिक्स की कना बया सम पूरा फुल लगा के फुल फ्लेज
We've just been joined by Professor Dr. Bilal Mohyuddin. Welcome, sir. Great to have you.
हमारा लास्ट क्वेश्चन दे यार इज्जत हमारे लगी इज्जत हम बची यार
20 seconds. Come on, it's a bouncer. Square leg is waiting. Come on.
ऑप्शन सी सर
Option
टाइप 3
C.
एंडोलिक
Again, I don't see the same vigor in the voice. Option C. Charlie, lock it. Oh, you were close, but it's 2. Type 2. Oh. Again, it's been caught at the boundary. Well, this takes us to the last question of this innings. Question number 10 on your screen.
Question number 10. What is the recommended follow-up protocol after EVAR? Option A, 1 month, 6 months, 12 months. Option B, 3 months, 12 months, 24 months. Option C, 6 months, 12 months annually. Option D, 12 months annually. Option E, 3 months, 6 months, 12 months.
And the timer's on your screen. 60 seconds.
فكرت انه اللي اكيد انا يو اني بس يو كده ها انت تو يسمع
12 months annually EVAR
لا
6
انه ما تدالك كنت بزين كسراجي
اصل کې repair دي کنه اخو غسیر الايمیجینګ چې کم دي every 6 month 12 month I don't know about the EVAR
اللي بقاله كان
One 612. Very not one.
हमारा 18 देखिए लग से
ठीक है. All right, 10 seconds.
ऑप्शन सी सर चार्ली
Option C, Charlie. Okay, we are really hoping for this one to be correct. Option C, Charlie. We need this one. All right, lock C, Charlie. And yes, we have it. And that takes us to a score of 24. It's still a meager total. This could be a fighting one, as we have seen in the last match as well. It was a low scoring game, 24, and the fight was on. So never lose hope. You never know what's going to happen. So with this, we come to the end of this first innings. And I'm going to move towards our umpire, Professor Mohammad Ishaq Saab. Sir, your thoughts on the game so far?
Assalamu alaikum. Another interesting match, and you're doing very well in the beginning. When Professor Fizullah was on the screen, I noticed whenever he goes off screen, they commit some mistake. So Fizullah Saab, I think score is not too bad, but could have been better. And some of the questions were a bit difficult, at least for me. And those with figures, it's always very tricky questions. But let's see how the other team does. Again, test of knowledge and competence. And this will enhance their appetite for learning more and more about these basics and figures. So I think cardiology has really evolved into a vast domain of figures and guidelines and cutout levels and so on and so forth. So I think they have to be up to date with that. AAA is another condition which is not often uh, diagnosed or usually missed. In the West, it's a very common condition, and all elderly people, they get ultrasound done to find out is there any aneurysm. And we do find come across cases where people come with acute abdomen, and then there's a bleeding inside, and it's due to aneurysm. So I think I'm glad that this tournament is bringing those areas into focus which we normally do not discuss or see in our routine life, but they are there. So thank you very much for my comments, and I'm enjoying your moderation. We have very distinguished colleagues, Bilal Muhyiddin and Professor Fizullah, to make any comments to add on. Thank you very much.
Thank you very much, sir. So I'll definitely move to our esteemed panel members, and we're lucky to have, in fact, Professor Hafizullah with us, and one by one, I think we'll take the comments. So, Professor Hafizullah, sir, are you there? Okay, so Professor Bilal Muhyiddin, sir, are you there?
Yes, I am here.
Sir, please.
Okay. Sorry, but number one, I joined in late, missed out the initial questions, so can't really comment on it. But the team is working up. Achha, I will recommend one simple thing. Mashallah, for Peshawar, inshallah, as time will progress, these programs are being recorded, and they will hold, inshallah, for posterity later on. Whenever you are having a discussion, कोशिश करो कि अंग्रेजी में कर लो वरना उर्दू में जरूर करो, because these two one being your national language and other being your professional language. The moment you start drifting into your local language, there's a few professors like Professor Ishaq who can understand, but I, for example, could not sort of follow up. So this is just a suggestion. It's for you to decide how you think, because this is a professional kind of a thing, and you try and limit yourself to two languages. Whenever, for example, we go into conferences, we limit ourselves to either an English language basically, and then we just sort of add on. Because if you are sitting, for example, inshallah, you will be sitting in Lahore in November, and over there you start, if you are giving a talk, and suddenly go into your local language and your local dialects, so you may lose your audience. So
unless PTI declares Pashto as the official language.
Sir, it will take time for us to learn the thing. आप भी मुझे एक lesson दे रहे थे, लेकिन Hafizullah was giving me a lesson, but I could not make a head and tail out of it. But anyway, so just a small suggestion. But anyway, but mashallah, good thing, and the best thing about this whole business about going for the endovascular thing is कि ये वो areas हैं जो currently are not there. And just for the knowledge about this thing, my very first patient that I actually later on found out was of aortic aneurysm was a teacher of mine. And we lost him to the ruptured aortic aneurysm later on. And that's what we think it was. It was back in 80s. And so ये चीजें हमारे यहाँ हैं, they exist, but they are not found and focused. Why? Because we are not looking for them. So, mashallah, I think I can see the great champion sitting over there himself with his old glory, but his cap is missing for some reason. But anyway, but he's looking fantastic as well. So, here you go. Thank you, sir.
Thank you.
Thank you very much, sir, for your extremely important comments. I think we all will second you on that. We need to have these two languages to, I think, stay within the format of the game, and for us to understand as well. And we have Professor Hafizullah now back with us, sir. Your comments, your thoughts on the game.
Sorry, I had to go out somewhere. I think it was an interesting case, and this sort of thing, we should have academic prowess so that we can work on it. This is something that peripheral arterial disease, we do not concentrate much, unfortunately, in our training. We are only focused on coronary artery disease. So I think it is good that you have brought to light this academic issue, and hopefully it was a source of learning for all of us. And I'm happy that we have come across this case, and I'm sure we're going to learn more about it. Thank you.
Thank you very much, sir, for your comments. Yes, it's a clinical scenario that we all as cardiologists come across, and we have to do the basics. And what this show has actually taught us, it's not about intervention anymore. We keep doing interventions. It's not only the interventional aspect, but it's also our clinical sense. We have to do the basics right. History, examination, all these things are important. How many times do we look for bruise? How many times do we palpate the patients? So that's going back to the basics. And now, I think getting back to the match, it's one half done, one innings done. Score to beat is 24, which has been put up by PIC Warriors. This could be an interesting game, as we have seen in the past. So what we are going to do is we're going to move now for the second half, the second innings, and let's have the start of the second innings then. All right, so can we have the next Vinay, the next scenario on the screen? Read it, please. PIC Warriors.
A 58-year-old gentleman, non-hypertensive and diabetic, having 30-year history of smoking, presented to the emergency department with 2-hour history of slurring of speech. On examination, he had a blood pressure of 190 by 124 millimeter mercury, heart rate of 100 per minute, regular. Cardiovascular examination revealed an ejection systolic murmur of grade 3 by 6 in the aortic area and a carotid bruit. Neurological examination revealed GCS of 15 by 15 with slurred speech and power of 4 by 5 in the left upper and lower limbs.
All right, so stars, we'll give you a couple of seconds to gather yourselves, and then we will start. Okay then, stars, are you ready?
Yes.
Okay then, bring the first question out. Read it, please.
In the given data, which of the following is the strongest risk factor for carotid artery disease in this patient? Option A, age. Option B, smoking. Option C, diabetes. Option D, hypertension. And option E, diabetes and hypertension.
60 seconds on your screen.
Carotid artery disease. So, can we have the vignette again?
हाइपरटेंशन और डायबिटिक दोनों है, स्मोकिंग भी है।
It's not related to this case.
आगे करो।
Yes.
Okay. Diabetes, hypertension, say diabetic, smoking.
Approaching 20 seconds.
Carotid artery disease, मेरे ख्याल से diabetes।
10 seconds, come on.
We will go with the option E, diabetes and hypertension.
Okay, are you sure? Should I lock it now?
Yes, please lock it.
Okay, E epsilon. Lock option E. Oh no, somebody said smoking. All right, so that's not the ideal start, but still you have a lot of margin. So be smart about the options. Question number 2 on your screen.
What is the blood pressure lowering target in this patient? Option A, BP less than 140 by 90. Option B, 25% reduction in blood pressure in the acute setting. Option B, blood pressure less than 180 by 110 millimeter mercury. Option B, blood pressure less than 180 by 105 millimeter mercury. And option E, none of the above.
Timer starts now.
So we will go with the option B, 25% reduction in blood pressure in acute setting.
All right, you've come down the wicket, aiming for a big 6. Are you sure?
Yes.
Option B, beta.
Yes.
Let's see whether you make Ishaq Saab happy or angry. Let's see. Lock B beta. Yes, you've made him happy. Great answer. And that's first 6 and you're on the board. Great stroke. Well done. All right. So, can we have the next question?
The patient undergoes a CT brain and undergoes IHSS assessment. All of the following are variable for the set score except option A consciousness, option B gaze, option C limb drift, option D planters, and option E neglect.
60 seconds on your screen.
Basically, what they do is they assess what is the severity based on that. Drift also. Consciousness is important. Gaze is also important. Planters, I'm not sure. Neglect is also a steady now, which will be identified based on the planters. I would go with I would prefer going with D planter. I'm not sure, but I guess planters are non-specific.
20 seconds.
Yeah. So we will go with the option D planters.
All right. You want me to lock option D delta. Are you 100% sure?
To some extent.
To some extent. All right. Lock D delta. And yes, brilliant answer. You've done a good job. Very well played there. Very well done. Okay. So let's have question number 4 on the screen.
What is this patient ABCD2 score? Option A 3, option B 4, option C 5, option D 6, and option E 7.
Timers on your screen.
तो डायबिटीज इसको है, ब्लड प्रेशर है 2
कम है 60 से और
कितना
डी के 2 डायबिटीज
तो डायबिटीज के 2 पॉइंट हो गए तो इसका कितना बचा?
इसका डायबिटीज के 2 पॉइंट है, ब्लड प्रेशर
तो 2 पॉइंट हो गया, 3 पॉइंट
He was the
duration
1 hour
20 seconds.
So उसका 1 hour ज़्यादा 2 hours की duration.
ठीक है.
Okay, 4. We will go with the option B 4.
All right. So they have opted to go with option B beta. Lock option B. Oh, that's a miss for sure. All right. You still have 6 more questions to go and you need 3 correct answers to win. Okay. Question 5 on your screen.
The patient undergoes an ECG that shows sinus rhythm. CBC shows a hemoglobin of 11 gram per deciliter and platelets of 350 lakhs in the per 10 raised to power 10 per 9 per liter and plasma glucose level of 24 millimole per liter. CT brain doesn't show any evidence of acute infarct. What is the patient's Canadian TIA score? Option A 9, option B 11, option C 12, option D 14, and option E 15.
Timer starts now. 60 seconds.
देखो आपसे हेमोग्लोबिन है, ये कहना चाह रहा है कि acute infarct कम उसको होना चाहिए. Infarct छुट्टी है.
Even miss.
और शुगर देखो कितनी है इसमें, ठीक है, और
20 seconds.
11 is quite high. 12.
Come on, 10 seconds. Hurry up.
So we will be with option B 11.
Option B beta, that is 11, right? Okay, so that's a mystery spin, and now they've put the leg out, trying to sweep it. Let's see where it goes. All right, block option B, beta. Oh, you were close, hitting the pads, and that's an LBW. All right, so you tried your best. We can understand. Okay, so can we have question number 6?
Within the next 30 minutes, the patient completely recovers from slurred speech and power also improved to 5/5 in all 4 limbs. Based on the above mentioned risk score, what should be the next step of action? Option A, discharge with routine follow-up in a neurology OPD. Option B, discharge and neurology review within 24 hours. Option C, admit an indoor neurology review. Option D, discharge with follow-up in medical OPD. And option E, prepare for TPA.
60 seconds on the screen.
Discharge and routine follow could be the answer. कि ठीक है, इसको TI और वापस follow करना है. Discharge and neurology within 4 hours. Again, अब हमें risk करना है
ABCD it was quite high.
तो echo कराई हो arrhythmia वगैरह ये चीजें. तो I guess होना चाहिए admit करने की उनको देखना. TI हुआ है, age भी ज़्यादा, risk factor भी ज़्यादा.
We will be
20
going with
seconds.
the option C. We will be going with the option C, admit and indoor neurology review.
All right, so they have opted for option C, Charlie. Okay, then lock C, Charlie. Yes, and that is a 6. You got this one right. Well done. Very well done. Well played. I think the way you were discussing, especially the two guys in scrubs leading from the front. Well done. Okay, so 18. Score to beat is 24. You still need 2 more questions. You have 4 questions. Question number 7 on your screen.
The patient is admitted and undergoes an ultrasound Doppler of the neck that shows right internal carotid artery peak systolic velocity of 250 centimeter per second and left internal carotid artery peak systolic velocity of 130 centimeter per second. What is the interpretation? Option A, more than 70% stenosis, the right internal carotid artery, and 50 to 69% stenosis in the left internal carotid artery. Option B, more than 70% stenosis of the right internal carotid artery and less than 50% stenosis of the left internal carotid artery. Option C, less than 50% stenosis of the right ICA and 50 to 69% stenosis of the left internal carotid artery. Option D, less than 50% stenosis of the right internal carotid artery and more than 70% stenosis of the left internal carotid artery. Option E, more than 70% stenosis of the right internal carotid artery and 70% stenosis of the left internal carotid artery.
Start the timer.
ये मेरा स्मार्ट है. ठीक है, इसका मतलब स्टेनोसिस ज्यादा है. ठीक है, सो तीनों ऑप्शन जो ए, बी और ई एन दोनों में वेलोसिटी ज्यादा है, 70 से ज्यादा. ठीक है, तो इसका मतलब ये है कि नैरोर जितना होगा उतनी वेलोसिटी यही था ना. तो वेलोसिटी राइट साइड पे ज्यादा है एज कम्पेयर टू लेफ्ट. और राइट बहुत ज्यादा है, 250 तो मतलब ए बी
Here left side.
राइट पे. अब आ जाता कि इतनी वेलोसिटी बहुत कम है. तो अब ये 50 69 लेस देन 50 या 70 70
Come on, we are approaching 15 seconds. Come on, 10 seconds.
We will be going with the option B, more than 70% stenosis of the right ICA and less than 50% stenosis of the left ICA.
Okay, so they want to lock option B, beta. All right then, lock B, beta. Oh, you missed it. You were very close. I think we were all enjoying the way you were narrowing it down. And it was always this left ICA which was going to make all the difference. Very close, nicely played, but never mind. Never mind. Well tried. All right. 1 question to tie. 2 questions for victory. 3 questions left. Play it smartly. This match means a lot. Question number 8. Read it, please.
All of the following can lead to falsely high ICA velocities except option A, vessel tortuosity, option B, contralateral ICA disease, option C, contralateral common carotid artery disease, option D, ipsilateral common carotid disease, and option E, carotid stent.
And the timer starts now.
I see a
velocities, higher velocities which are
या
falsely high.
टॉर्शियस वेसल से बढ़ेगी, तो ये सवाल है कॉन्ट्रालेटरल आईसीए डिजीज हो कि हमें इसको कवर करना एक्सेप्ट करें ना, इट कुड कॉन्ट्रालेटरल आईसीओ कॉन्ट्रालेटरल कॉमन कैरोटिड दोनों में हो सकता है। तो इप्सिलेटरल कॉमन कैरोटिड मतलब कि अगर यहीं से वेलोसिटी आपकी तेज बनी हुई आ रही है तो वो कह रहा फॉल्सली हाई, तो ट्रूली आ सकती है। कैरोटिड शुड बी लाइक मेरा थोड़ी फर्स्टली हाई सबसे हो सकती है एक्सेप्ट क्या
There is a narrowing down before the upstream narrowing.
इप्सिलेटरल है तो
15 seconds.
Then second. What?
7 seconds, come
We
on.
will go with the option A, vessel tortuosity.
Okay, so they have opted for option A, alpha. It seems like a flipper. Where is it going? Let's see. Lock A, alpha. Oh, that's a miss for sure. You missed it totally. Well. So now it has gotten very interesting. What you need, 2 correct answers. We are left with 2 questions. You have to answer them correctly to qualify. I hope you understand, and best of luck to you, and also to our PIC warriors. Let's have question number 9 on the screen.
The patient undergoes a carotid angiogram that reveals 90% stenosis of the right internal carotid artery and 40% stenosis of the left internal carotid artery. The patient is not keen for carotid endarterectomy and carotid artery stenting is considered. Which of the following will favor carotid artery stenting over endarterectomy? Option A, high carotid bifurcation. Option B, low carotid bifurcation. Option C, older age. Option D, type 3 aortic arch, and option E, severely calcified lesion.
Timer is on your screen now.
कैल्सिफाइड लीजन होती है, वी वांट कि इसको एंड आर्टरेक्टमी करें, ठीक है। हाई कैरोटिड आर्टरी बाइफरकेशन बहुत नजदीक है, यहाँ स्टेंटिंग से बेहतर है कि हम लोग बाईपास की बात करें, कॉरोनरी थॉट सोच रहा हूँ। अब लो कैरोटिड आर्टरी बाइफरकेशन मतलब अगेन वो नीचे की तरफ बाइफरकेट हो रही है कैरोटिड आर्टरी, ये कहना चाह रहा है कि ऐसे ऊपर यहाँ नहीं हो रही और नीचे बाइफरकेट हो रही, सो दैट कुड बी बट डिफिकल्ट, यू नो। तो अब हम ऑल्टर एज टाइप 3 होंगे। फेवर है क्वालिटी स्टैंडिंग किस चीज का फेवर करना।
20 seconds.
अगर किसी ऑल्टरनेट पेशेंट को कैरोटिड आर्टरी डिजीज हो
10 seconds.
So we will be going with the option C, older age.
Option C, older age. So they want us to lock option C, older age. Right, so before we move on, I think this is a very interesting stage of the tournament, especially for this group, because if PIC wins, they are through. If Aga Khan wins, they are through. And if they both have a draw, then MIC Multan is going to be through. So let's see, there are 3 teams hanging in the balance. All right, lock the option. Option C, Charlie. Oh! It's missed. You've missed this one. All right. So I think we now know 2 things for sure. Aga Khan stars can only draw the game if they answer the next one correctly. PIC is still in the game. MIC is still in the game. Let's see what happens. All right. Last question of the match today. Question number 10 on your screen.
The patient is planned and undergoes carotid artery stenting. How do you plan to prescribe antithrombotic regime? Option A, lifelong aspirin. Option B, lifelong aspirin and clopidogrel for at least 6 weeks. Option C, lifelong clopidogrel. Option D, lifelong aspirin and clopidogrel for at least 6 months. And option E, lifelong aspirin plus prasugrel.
And the timer is on your screen, 60 seconds.
लाइफलॉन्ग प्रॉब्लम हाँ न्यू गाइडलाइन कहती है कि जब भी टेक होगा और
पर स्टेंटिंग का है
स्टेंटिंग
ये put this into perspective only have to be perspective दी हो
तो हम दे रहे हैं जिसको स्टैंडिंग का
हाँ
6 भी देंगे 6
Approaching 20 seconds.
So
Come
we
on,
will be
stars.
going with the option D, lifelong aspirin and clopidogrel for at least 6 months.
Okay, so you want me to lock option D delta. Okay then, let's see what we have here when we lock it. Lock D delta. And it's a miss. You've missed this one as well. So I think this closes the match. And now we have a clear result here. So it is PIC, Peshawar Institute of Cardiology Warriors, who have actually won the game today. Congratulations to them. But there's one thing that I've been told, that it's MIC, Panthers, Multan Institute of Cardiology. Panthers, by virtue of their scores, they have gone through. So congratulations to them. Congratulations to PIC Warriors today for their game. And also I would say congratulations to Aga Khan Stars for being with us in this tournament and playing like stars. It's victory all around, and it's all about learning, as I think we have talked about it so many times. That's the key idea, is to learn things, to know better, and to treat our patients in a much better way. So with this, I think we have the panel of experts, and I have Professor Ishaq Saab with us. Sir, your thoughts?
Thank you very much. Another very interesting and close competition. And another scenario which is often, as Professor Fuzula mentioned, areas not usually discussed or focused. So I think these successes and failures will definitely prove a stimulus to read non-coronary cardiology as well, and take cardiology as a whole, not just focused on coronary arteries. So I think AKU could have done better, but well, one team has to lose, the other has to win. And now we have got an interesting situation that it is MIC, Multan Institute of Cardiology, which is going to be through the final round. So again, as we always say, it's a learning procedure for everybody. Nobody should get discouraged. Nobody should become euphoric about it. It's a matter of reading more and more and learning more and more, and focusing on areas which we normally neglect. So thank you very much for having me.
Thank you very much, sir, for your extremely important input. I think always a lot to pay heed to for everyone. I think when Professor Ishaq Saab, he sums it up, and all our mentors and our faculty members, I think the common belief is to pay more attention towards all the aspects of cardiology, not only coronaries and intervention, because that's going to make you a complete cardiologist. And with us, I think I'm going to move towards our other two stalwarts. We have Professor Hafizullah. Sir, are you there?
unmute.
So you'll have to unmute, sir. I think you are on mute. Sir, we can't hear you.
Hamza, can I just add one
Sir, please.
point?
Yes, sure, sir.
I just wanted to emphasize on these trainers and fellows, how many of us routinely look for carotid bruit or abdominal bruit. I think today's both scenarios demand us that when we are examining the patient, we should examine for any carotid bruit and abdominal bruit, especially in the elderly patients. Thank you.
Sir.
I think you can hear me now.
Yes, sir, we can. Please go ahead.
I think these both cases were very interesting. They required in-depth knowledge. They required more detailed information about different classification that we do not routinely use. So, of course, there is an element of error that can come in because we are not using this. So, I think it's a good idea to discuss cases like this so that we can enhance our comprehension of such cases. So I'm happy that we are moving a little away from our comfort zone of coronary arteries, and these are also an important aspect of life that we have to deal and handle. And I'm happy that our boys on both sides perhaps will come out wiser and perhaps more knowledgeable about this aspect of cardiovascular disease. Thank you.
Thank you very much, sir. I think it's an extremely important point highlighted, and I always tell this on different forums. I talk about it because now, whether it's the primary prevention like ASCVD scores or the pulmonary embolism or heart failure, Seattle scores, I think our minds are more receptive to numbers, and we need to have risk stratification because that actually tells us where the patient is, how we have to deal with it. And again, it's the same thing. These scores help us, and if we are aware of them, we are using them. I think this makes our job easier, and this is the way to go. So we do have Professor Bilal. He's there. Sir.
Assalamu alaikum once again.
Sir.
So जैसे कि अपना इन्होंने कहा ना कि we have stepped away and it's an opportunity. हफीज साहब और इसाक साहब माशाल्लाह उस एरा के लोग गए जब ये सारी चीजें नहीं थी जो आजकल हम लोग इस्तेमाल करते हैं, all these echocardiograms etc. If you sit down with them, they will tell you of the basic echo, and they used to have those papers running out, and then they would have an analysis of the mitral stenosis that was done. For the students, I've got one thing, and if I can have your attention, especially of the young lady sitting over there, I think they're all busy. Can I have the attention of the blue cardigan dressed and the dressed lady? Hello. बहुत ज़्यादा गप्पे लगा रहे हो बेटा, बाद में गप्पे लगा लेना. Listen to what I have to tell you something. The very first question that came up, वो देखो था क्या? वो ये कहता है कि it was such a beautiful trap set, and hats off to those who designed it. They said diabetes and hypertension, and you opted for it. It's a different vessel. It's a different thing. जिस वक्त हम लोग MCQs की initial training करते थे ना, तो they used to give us these ideas of how to trap a person, and that was an example of trapping a person and then hitting you down. Something totally different was a question of smoking. हम लोग smoking को importance नहीं देते. And the reality is this, that we have forgotten what smoking is all about. It's about nicotine consumption. That's what cardiologist is against. I'm just going to put a small question, and I'd like to see the winners of the today give me an answer. Can you hear me, both of you, both the teams, the winners of today or the losers of the today? But if a person is smoking 10 cigarettes a day for 10 years, 10 cigarettes a day for 10 years, आप क्या कहोगे कितने pack cells है? Pack cells के?
5 packs per year. 5.
And if I'm smoking 20 cigarettes a day for 5 years, तब क्या कहोगे?
5 pack per year, sir.
And if I'm smoking 40 cigarettes a day for 2.5 years, तब क्या कहोगे?
5 packs per year.
तो आपके लिए 5 packs का एक ही मतलब है. ये तीनों शख्स आपके हिसाब से एक ही है. एक 40 सिगरेट रोज के पी रहा है, एक 20 पी रहा है, एक 10 पी रहा है. ये चीज आई है हमारे यहाँ कार्डियोलॉजी ने अडॉप्ट कर लिया फ्रॉम पल्मोनोलॉजी. That is where we are going wrong. Because when the nicotine comes in, it accelerates your heart, it narrows it. सारी गड़बड़ें शुरू हो जाती हैं और हम उस चीज को फोकस करना भूल गए. हम पैक ईयर करते करते कार्डियोलॉजी का बेड़ा गर्क करने पे लगे हुए. काइंडली ऑलवेज यही पे आपका ट्रिक था. वो जो आपका 58 का इयर्स ओल्ड पर्सन, इतने पैक ईयर्स हैं, ये है वो है, आप वहां पे कंफ्यूज कर रहे हो. ऑन दी अदर हैंड अगर सीधा सा ये हो आपकी हिस्ट्री टेकिंग में, अगर ये आप कहो कि ये बंदा रोज के इतने सिगरेट पीता, इतने सालों से पी रहा है और आज भी इतने पी रहा है, आपके सामने पेशेंट्स आते होंगे जो कहते होंगे जी मैंने सिगरेट कम कर दिए, मैं पहले 20 सिगरेट रोज के पीता था, अब 5 पीता हूँ. It's not as if the risk has gone away. The pack cigarettes are still there. The way I do it is I count the number of cigarettes a person has per month. Because फिर हम कहना शुरू करते हैं ना कि यार 6 महीने से सिगरेट नहीं पिया तो उसको बेनिफिट आ गया. Your first benefit of stopping smoking is when your carbon monoxide tagged hemoglobin goes down. एंड उससे पहले आपका बेनिफिट आ जाता है एक दिन में जब आपका हार्ट रेट और आपका बीपी कंट्रोल आना शुरू होता है. सो दैट वाज वेयर द ट्रिक वाज. हम लोग इतना कॉर्नरीज के साथ वो एसोसिएट हो चुके हुए हैं कि वहां पे वो फिगर्स हमारे इतना से आते हैं कि स्मोकिंग क्या. और गौर से देखो जो पुराना फ्रेमिंगम स्कोर है वो सिर्फ ये कहता है कि आर यू अ स्मोकर और नॉट अ स्मोकर, विच बेसिकली मीन्स कि आप 1 सिगरेट पी रहे हो तब भी स्मोकर हो और 100 सिगरेट पी रहे हो तब भी स्मोकर हो. और वो हम हुक्का को उसमें डालेंगे नहीं, हम शीशे को डालेंगे नहीं. हमारे लिए ये सारी वो प्रॉब्लम्स हैं. सो लुक एट, लेट अस इंप्रूव आवरसेल्व्स एंड गो अ स्टेप फॉरवर्ड. हाँ, अब हो क्या रहा है दुनिया में, अब ये हो रहा है हमारे फील्ड में, ये हो रहा है कि जिस बंदे को आते हैं ना आपके पास चेस्ट पेन के साथ, तो आप कहोगे ये कार्डियोलॉजी का पेशेंट हो गया. और अगर वो अब्डोमेन की पेन से आ रहा है ना और आपका वो बाहर सीएमओ बैठा हुआ है तो सर्जरी का पेशेंट है, इसको अब्डोमेन के लिए वहां भेज दो, अब्डोमिनल पेन के साथ आ रहे हैं. सो द थिंग इज दिस दैट समवेयर समवन हैज टू सिट डाउन एंड पुट रियलिटी चेक. और वो रियलिटी चेक क्योंकि हम लोग लूज कर गए हैं, इसलिए हम लोग ये मिस्टेक्स कर रहे हैं. जरा सा क्रोटेड की बात आई, इट्स अ न्यूरोलॉजिस्ट जॉब. नाउ fortunately or unfortunately, I'm using the word fortunately or unfortunately, cardiologists have started going, because they have the access to cath lab, into carotid territory and also into the vascular territories of the other part of the body. आप हर जगह घुसने की कोशिश कर रहे हो और क्योंकि आप हर जगह घुसने की कोशिश कर रहे हो, thus your scores start coming in, and that is where the big challenge has come up. अभी तो ये वाली डिस्कशन हो रही है ना, आई एम जस्ट वेटिंग फॉर द डे जब आप में से कोई शख्स वेरिकोज के बारे में डिस्कशन लेके बैठ जाएंगे यहाँ पे. नॉट दैट आई एम गिविंग एन आइडिया फॉर एनीवन टू कम अप विद दोस क्वेश्चंस ओवर देयर, बिकॉज दैट इज गोइंग टू बी रियली बी अ बिग किकर फॉर एवरीवन. बट प्लीज डू कंसिडर one of the main tasks of these academic activities is that we have to improve our services for our public at large. But anyway, fantastic and well played, and it was very, very tricky questions and things that I think a lot of us also got out of it, because हम लोग ये क्रोटेड का काम करते ही नहीं उतना और इसलिए हम उनको फोकस ही नहीं कर रहे होते. And that is why I do not blame anyone for it, and I think you played very well, and these are the things that we need to assess. And someone had to win, and without playing, Multan managed to win, and it's fantastic. Multan ka, I don't know unka score kya tha, but whoever is going, and I'll be your host over here for that day, and inshallah, looking forward to welcoming you with a big, strong handshake. अब आहिस्ता सा हाथ भी मेरा ठीक हो रहा है, so inshallah we will be there to you. And Isaaq sahab, inshallah, looking forward to seeing you. I hope you are coming down for the Peshawar meeting, for the Multan meeting.
Of course, sir. Of course.
Right. And then you'll be staying in Pakistan and coming for Lahore meeting also.
Inshallah.
Inshallah, sir. तो बस ठीक है फिर काम. The match is on. Thank you.
After a weekend Lahori breakfast, Bilal Muhyiddin always comes up with a very good ideas and new thoughts and highlights areas which are often ignored. I think smoking is an extremely important subject in our part of the world, as most of the youth in the cities as well as in the villages are consuming tobacco in different forms. And nicotine is not only injurious directly to the coronaries, but it acts as a catalyst to diabetes and hypertension and hyperlipidemia and so on and so forth. So it's a great villain in the pathogenesis of atherosclerosis, which should not be ignored. और अक्सर जब हम पूछते हैं कि आप स्मोकिंग करते हैं तो कहते हैं नहीं है. जब आप उनसे पूछते हैं कि आप बीड़ी पीते हैं या हुक्का पीते हैं तो वो एडमिट करते हैं. Our population thinks that smoking is only cigarettes, and they don't consider hookah, chillum, the other means of consuming tobacco as smoking. So it is for us, for the doctors, to dig out this information from the patient. And as Bilal said, it's not a matter of, okay, kitne peete hain. Either you smoke or you don't smoke. Either you believe or you don't believe. So that's the sort of situation. Thank you.
Yes, sir. Thank you very much, sir, for your input. I want to thank Professor Bilal Mohyuddin. I think it definitely became a show within a show, and I think the interaction that you've had with our fellows, this is exactly what's needed. And I totally agree with you. I mean, it's inversely proportional. The smoking, it's directly proportional to the damage that it's doing with the nicotine that goes in. And I think we need to have these questions very clearly put up. And definitely the cardiovascular mortality goes up, and smoking is as big a risk factor as diabetes, hypertension. And as cardiologists, it's not only the heart or the coronaries. I think we are more of angiologists. We have to deal with many other things one way or the other. So with this, we are now coming to the end of this match today, and in the Super Sixers match.
Comment from Dr. Bilal that the first question was a trap.
It definitely was, sir, because you see, the moment you see two risk factors.
I join him in complimenting the person who has said the scenario and the question. I think, yes, it was a trap, because the moment they saw diabetes and hypertension, they jumped on it.
Yes.
And they ignored the rest of it. So I think interesting.
So it was a big distractor, as we call it, while we are making the MCQs. So, and it turns out it was a big distractor for sure. So
that's the beauty of the question. You see, that's the beauty of the examiner.
I think, sir, it's not only the candidates, our examiners, all those people who are working behind this show in setting up the questions, they are also coming of age. And, you know, every day we have these new sets of questions. So it's wonderful. It's the teamwork which is shining in the Super League.
In UK, we used to have in our exam a red herring, you see. So a red herring should not be ignored. Any good paper setter will have a question, the question MCQs, a red herring which will attract you, but it is not the answer. It's like I don't know. I don't want to give a example which doesn't fit into the academics, but
बात वही है जो आप कहना नहीं चाह रहे.
समझने वाले समझ गए. Thank you, ji. Allah Hafiz.
Thank you very much, sir. And I think we'll definitely be there to shake hands with Professor Bilal Mohyuddin. We all look forward to it for sure. And it's going to be a wonderful stage for everyone. So with this, I think we now have the winners for today's game. It's PIC Warriors who have won the match, and we all know that Multan Institute of Cardiology MIC Panthers have actually gone through. So it's congratulations to all the teams, MIC, PIC, and I would say Aga Khan Stars for putting up this wonderful league and performing so well. And congratulations all around. I want to congratulate our sponsors, Wilson's Pharmaceutical, and also Pakistan Cardiac Society. So with this, we now reach the end of today's match. So best of luck, have a wonderful weekend. Until next time, it's Allah Hafiz from us.